People seek counseling for many reasons: stress, depression, inability to cope with difficult family dynamics, and the list goes on and on. And all of those have been on the rise, especially because of the pandemic, which has brought some pretty divisive politics right into people's family rooms. Add that to a polarizing political landscape, and guess what's turning up as an issue for people and therapists alike? Politics, of course. Let's find out more with, in Vancouver, British Columbia, Jennifer Hollinshead, founder and clinical director of the counseling practice Peak Resilience. In Winnipeg, Manitoba, individual and relational therapist Leslie Hackett. And in the midtown of Ontario's capital city, Kati Kemkar, clinical psychologist and assistant professor of psychiatry at the University of Toronto. And we're delighted to have the three of you on our program tonight for a discussion. And let's set it up with this. According to an American study conducted, admittedly, before the pandemic in 2019, about 40% of participants consistently identify politics as a significant source of stress in their lives. And Kati Kemkar, why don't you get us started? Are you seeing the same thing post-pandemic in your practice in Canada?
Thank you for that. And I think that it is such a great and interesting topic. First of all, I'm going to speak here as a PhD clinical psychologist, because again, all different professionals, our training could be very different. This topic has always been an interesting and hot topic, but also not only in therapy, but generally in our everyday life as well. And when we talk about politics, people can also refer to it sometimes in their daily life. Certainly with pandemic, it could be with elections or a host of other things going on, including within their personal settings as well. But I think the context also matters here. So it's such that if we're dealing with overall fatigue, or we feel bombarded with a lot of information, adding to that, of course, with the pandemic, that where our daily life, our daily structure and routine, our work and home life and roles and responsibilities, everything kind of had to change quite drastically, and not only once, but we have had to create a new normal throughout the pandemic to this date because of constant fluidity going on. So when you add to that, it becomes sometimes very overwhelming, and it adds to what we sometimes refer to is not only this information overload, but in also this brain overload because of the impact on the brain fatigue and our ability to process information and make optimal decision.
Leslie Hackett, let me tap into your experience on this. Is it common for patients, for example, to bring up politically induced stress or depression during therapy?
It is definitely. I work with individuals as well as couples and families. I do relational therapy as well. And family rifts because of differing political opinions and opinions on various social issues is becoming increasingly common among the reasons that people seek therapy. It is increasingly stressful for people who feel like they can't have peaceful, reasonable interactions with friends, with family members, even with their spouses or their partners because of differing social or political views. And that's definitely something that a lot more of my clients are talking about.
Jennifer, just tell us before you answer the same question, what's the approach you take with Peak Resilience?
Well, we're very transparent about, and I wouldn't ever describe us as political, but we are transparent about the ideologies and the ideas that are sometimes seen more as probably left politically. So, but we're really transparent about that. And the reason that I, as the founder of Peak Resilience and a clinical counselor myself, have been transparent is I want to provide trauma-informed care. Everyone in the world has experienced collective trauma in these last few years, but also all different types of individual trauma. And so when I'm transparent on our website about being feminist, for example, that means that we are going to be looking at problems and issues from a systemic lens, which we believe helps people heal and feel more empowered and feel less shame about their individual struggles. And we believe that that is actually what the world needs in terms of sustainability. There has been many, many studies and people looking at the effects of gender equality and climate change, for example. So we're just trying to be transparent. And I also sit on the board of directors at the BC Association of Clinical Counselors. And we've had these conversations where people aren't necessarily in agreement over my approach and my transparency because not everyone has these views.
No, I get you. So let me jump in with a follow-up on that, which is to say, because you are transparent in the way you do your job, is that to say you are going to have more than your share of people who come to you and say, as an example, holy smokes, I am just having a real tough time with the whole trucker convoy, or with Trump, or with, fill in the blank on the conservative side of the spectrum?
Yeah, absolutely. And they usually are talking about whatever their political concerns are in relation to the deep relational issues going on in their lives. So they might be afraid of what's going on with the trucker convoy. And basically, the anxiety that they were normally experiencing goes from a 2 to a 10 because they are living right beside a protest zone. So absolutely, it comes up.
Caddy, simple things like wearing a mask, or whether you want to be vaccinated, or the convoy, which was not so simple, but it's another example of something that became truly polarizing over the past couple of years. Do you see those kinds of things showing up when you're dealing with people?
Absolutely, because as you mentioned, those things have led to relationship strains and conflicts and arguments. Do I attend this setting? Do I attend this party? And what do I do? And so on. So everyone's preferences and experience are going to be very different. But the goal is really around minimizing any symptoms, optimizing a person's functioning. It could be their personal, occupational, social functioning, but it's really also around, as we talked about, in building the individualized pathway to self-care, building our emotional resilience and developing strategies, proactive coping strategies. So for everyone, it's going to be different, but it's often, again, not necessarily the actual situation. Like, for example, we just gave the example of the protests or the truck related the stress and so on, but it's around what can I do? How can I cope with it to boost my quality of life and the well-being?
Yeah, Leslie, can I get you to weigh in on that as well? Have you seen people come forward saying the whole mask debate has really got me, down, or the whole issue of lockdowns? I've really run into some difficulties with family or friends over the issue of lockdowns, and it's really getting to me. Is that part of your daily reality?
Absolutely. And when we get into those issues, again, the issue, like my discussion with my client is not necessarily about whether wearing masks should be required or whether it is appropriate or if effective. It's about the effect that the stress of that of the disagreement is putting on them. The effect of the accumulating stress that we've all been dealing with for so long, not just because of the pandemic, but because of all the other issues that we're dealing with locally, nationally, globally, that puts increasing pressure on us, and that puts increasing strain on our relationships. And so what I try to focus on with my clients is what is the best way to navigate this conflict? How do we want to react? What do we need from other people in terms of improving our relationships and our interactions with them? How do we not let this accumulating stress interfere in the types of relationships that we want to be able to have with people?
I'd also like to find out how all of this has an impact on all of you. For example, Jennifer, I don't know, are there circumstances where you find yourself feeling say more vulnerable than not because of a particular difficulty that a client has?
Absolutely. And that's another part of intersectional feminist therapy, is realizing and believing that the therapist is not kind of the well and good treating the bad and broken. The therapist is a human being alongside a client who is also a human being. And so I have gone through my own recovery and still processing sexual trauma that I've experienced and my own mental health struggles that resulted. And so I'm really trying to practice what I talk about. And that's really where I find meaning in the work. And I find my clients and my colleagues, because I also supervise people doing this, find so much meaning. And that's where we get resiliency in the work. Is it's not just treating symptoms, it's not just changing thoughts, it's actually looking at, wait a second, what's actually going on in the world? How can we understand it better? And how does it impact our mental health? And what power do we have to shift it?
First of all, thank you for being so honest about that. Second of all, it does raise the interesting question of who does the consultant consult when she has a problem? How'd you figure that out?
I have supervisors and my own therapist and my colleagues, and we are always consulting, and we always are trying to critically reflect on why we're doing what we're doing and what is my own stuff that maybe is not helpful for this situation. Maybe just put this aside, but also if the person in front of me is suffering from something that I think it might help for them to know that I've had the same experience, I'm not going to hold that back just because it's been taught to me that I should be a professional, kind of a blank slate.
Gotcha. Caddy, because I've met you before, I also happen to know that you are a very diminutive person, which I think could add to your vulnerability if you find yourself in a difficult situation, particularly if you were with, let's say, a client who was 6'2" and 200 pounds and male. So how do you negotiate around all that vulnerability?
I think that, when we talk about anything that we do at therapy, I also practice it with myself and I want it in my everyday life. So building our individualized pathway to self-care, to our resiliency, emotional resiliency, proactive problem solving. And in therapy, everyone can have their own unique preferences, unique experiences, and it's all around building and optimizing collaboration, engagement, because as we know, these are also the key predictive factors to positive therapy outcome. And so it's always, I love the individual differences, the diversity, the healthy and positive challenges and the excitement. And whoever I see, I always say it has so much contributed to my own resiliency. So I welcome anyone. And I always say, I want therapy to be fun. Yes, I'm a trauma doctor. I do a lot of trauma work, but it's also making it fun, making it great, making it memorable.
Leslie, how about you on that? How do you deal with the vulnerability that you no doubt encounter in your practice?
That's a good question. It's making me think of a specific example. So as a person of color, I have, I think no one is unaware of the increasing tension around and attention to and action around systemic oppression, particularly since the summer of 2020 after George Floyd was murdered. And since then, I have noticed an increase in the number of Black clients specifically wanting to work with a Black therapist. So that opens the door to a lot of discussions, which at the, below the surface is the stress of dealing with systemic oppression. But sometimes closer to the surface are the questions of political beliefs. And some clients might be surprised that depending on what types of views they express, I am not necessarily going to not challenge them, because good therapy is about finding the balance between comfort and a good alliance, and challenge. It's a strong therapeutic alliance that allows for the necessary challenges that I have to do with my clients in order for therapy to be effective. So that's kind of on one side of it. On another side of it, and again, getting back to the specific example that I'm thinking of, I had a first session with a client who, I won't give any details, but I will say that the client was displaying an article of clothing that had a particular symbol on it that has been associated with certain political views that I personally find reprehensible. But as a therapist, my job is not to immediately attack that person and criticize them and question, how dare you wear this symbol in my office? My job is to approach that person with curiosity about what that symbol means to them, what their understanding is of it, how they see themselves in the greater social context. And then hopefully we are able to build, again, a strong enough therapeutic alliance where I might be able to eventually question the client about how they think that symbol affects other people, and particularly me as a person of color sitting across the room from them. So I've had a lot of very interesting and nuanced discussions with people, depending on how similar or different our social and political views might be.
Okay, Leslie, that is too dramatic and delicious a story for me not to follow up on, so here goes. I'm just going to give a for instance here. I don't know if this was the case that you're referring to, but let's say somebody walks into your office with a skinhead and a Confederate flag or, on their T-shirt. How do you hold yourself back from wanting to go up to that person and smack him in the face?
Of course, let's just, under no circumstances, even outside of my therapy office, would I do anything like that. Regardless of the subject matter, it's really important for us as therapists to remain grounded and to be aware of what we are experiencing and what we are feeling in the room with clients. I think that's a huge part of doing good therapy, and also taking care of ourselves and protecting ourselves. And if anything was happening in the therapy session that was making me feel unsafe, I would find a way to extricate myself from that situation. But I would definitely be curious as to why that particular person came to meet with me. I used to work in an agency where clients were just assigned to me, and they didn't know me. They had probably never seen me before. They would just get, they would be given my name and an appointment time, and they would show up. And I am definitely aware that some people seemed taken aback to see probably a person of color. Maybe that's not what they were expecting. But in my private practice, people seek me out specifically. So if somebody sought me out in my private practice and then showed up dressed as you described, I would be very curious about why that person wanted to meet with me. And I would, again, I would ask what that symbolism means to that person. And I would also ask a lot of questions about that person's experience in the session with me. What is it like for you to sit in a room with me? How many people like me do you have contact with in your daily life? So it's just a lot of questions. And even as disagreeable as I may find the person's views, it is my job to approach that with compassion and empathy, because positive change in people does not take place when they are attacked and blamed and criticized. Positive change takes place when we are able to help people reflect on themselves and be introspective, and to understand how their views affect their behavior, and how their behavior affects their interaction with other people, and how they fit into the world.
That's a lot of very impressive professional self-control. So thanks for that answer. Let me read something here. This is an excerpt from a publication called The Conversation, and it's from an article called "Political Polarization is Affecting Mental Health, and Patients Want Therapists Who Share Their Views." Okay, here comes the board. Between polarized politics and disagreements about COVID-19 response, It was only a matter of time before political stress arrived at the offices of psychotherapists, psychiatrists, and mental health workers. These discussions have occupied the center of multiple sessions in a way that for some therapists has not been seen since 9/11. Okay, Jennifer, take us through this kind of a scenario. You're doing a consulting session, and suddenly you find yourself, let's say, on the opposite side of someone who says, all this vaccination stuff is a lot of mumbo-jumbo crapola. They're just trying to inject us with, transistors so they can read our thoughts. I'm assuming, sorry, that you don't believe that. And therefore, you are now on the opposite side of the issue from somebody you're trying to help. Okay, play it forward. What do you do?
First of all, this happens more often than you would think because therapists and their supervisors are humans. So this is a very normal occurrence and something that we talk about in supervision, and we talk about it in therapy. So if I was in a therapy session with someone, first of all, before we get to the point where they share their views, I want to piggyback on what Leslie was sharing, which is the absolute most important predictor to therapeutic success is the therapeutic relationship between the human being who's the counselor and the human being who's the client. So when we're meeting with someone, we're making small talk, we're taking a genuine interest in their lives. It's back and forth. So by the time someone shares their viewpoint on vaccination or, whatever their strong viewpoint is, I would like to have a strong enough relationship professionally with that person to say, yeah, like personally, that's not my personal belief. And so how is that going to impact our helping relationship and the work that we do in here? Because you know how much I respect you and your struggles. And we can have differences of opinions while still doing the work that you're wanting to do, which is you're wanting to work on X, Y, and Z, which is what brought you into therapy. So this is something that happens all the time. And I think it's more ethical to be more transparent about our personal issues as human therapists, because I think the history has been we present as we're not supposed to have opinions, and we're totally blank slates, like I mentioned before, and that's a misnomer. That's not possible.
Katty, let me ask you the same kind of question. And let's say, for example, that a client was walking into your office, and this was at a time where, let's say, you would have kind of preferred everybody to be wearing masks. And you discovered that the client not only is not going to put a mask on, but thinks anybody who wears a mask under any circumstances is an idiot. How do you handle that situation?
Well, thankfully, I have not encountered that situation because of the wonders of the virtual world. And we have now great data showing how telemedicine, teletherapy, and telehealth and video therapy are very effective, if not even as effective as in person. But of course, we need further data, further research. But prior to even setting an appointment, it's about, of course, setting the policies and what are the policies and guidelines for any also in person. So this is something that the person would walk in with an absolute knowledge. Now, even for, let's say, video or telehealth, prior to any appointment, now clients, it's a positive thing. They often express their preference, and that's important. So they would say, well, I prefer to have a female therapist. I would prefer to have a male therapist. I would prefer someone with this religious background or this cultural background, and so on. So as much as possible, we want to optimize the match. Again, it's unique preferences and unique experiences. So again, these are all starting more proactive approach. Then it's about setting, prior to any treatment, it's about setting the initial assessment and consultation to have a better understanding of what are the person's presenting concerns, to have an understanding of the person's case conceptualization, and of course, if there are any diagnoses or not, of any diagnostic mental disorders. So all is for a treatment treatment planning, evidence-based treatment interventions, evidence-based cognitive behavioral therapy, at times depending on the severity of the symptoms, mild to moderate, it will be combined CBT and with medications, etc., etc. Now, at times also people might not even meet any clinical threshold, but it's really working on preventative measures, proactive measures to build the quality of life and the well-being. So it's again so if anyone would enter therapy, we want to listen on what are the persons presenting concerns, because if they are coming, there is something. And so it's not about necessarily me believing or agreeing with, but it's about helping them how they can manage their everyday life better, and of course interpersonal relationships better, and everything surrounding their life. So for example, they don't want to wear a mask, okay, but they also know that with not wearing it, maybe it has created a conflict in their personal life, family life, or maybe work life, or day to day. How can we resolve those issues? So it's again quality of life and well-being and the overall functioning. And I think that here is, I think all we're talking about taking together, it's also growth. It's focusing on the person's growth, psychological growth, personal growth, their emotional growth, which is, it never ends. This is true for me, for all of us. And that's the beauty of a human being.
Indeed. I have to say, this has been a most instructive and informative last half hour. And am I allowed to say this? And very therapeutic for the host as well. So thank you, you three. Jennifer Hollinshead, Leslie Hackett, and Kati Kamkar. Really good of all three of you to join us here on TVO tonight. Thank you so much.
Thank you. It's been my pleasure to speak with all of you.
Thank you so much.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.